female reproductive system. Ovaries produce second oocytes and hormones. Uterine tubes transport fertilized ova. Uterus where fetal development occurs. Vagina and external genitalia constitute the vulva. Mammary glands produce milk. Follicular stages. Stages of follicular development. Primordial, primary, secondary, Graafian, ovulation. Corpus luteum is ovulation wound. Fills in with hormone-secreting cells. Corpus albicans is white scar left after corpus luteum is not needed. Histology of a Graafian follicle. Zona pellucida, clear area between oocyte and granulosa cells. Corona radiata is granulosa cells attached to zona pellucida still attached to oocyte at ovulation. Antrum formed by granulosa cells secreting fluid. By this time, the oocyte has reached the metaphase of meiosis II stage and stopped developing. First polar body has been discarded. Life history of Oogonia. Germ cells from yolk sac migrate to ovary and become Oogonia. As a fetus, Oogonia divide to produce millions by mitosis, but most degenerate, atresia. Some develop into primary oocytes and stop in prophase stage of meiosis I. 200,000 to 2 million present at birth. 40,000 remain at puberty, but only 400 mature during a woman's life. Each month, hormones cause meiosis I to resume in several follicles so that meiosis II is reached by ovulation. Penetration by the sperm causes the final stages of meiosis to occur. Review of oogenesis. Histology of the uterus. Endometrium. Simple columnar epithelium. Stroma of connective tissue and endometrial glands. Stratum functionalis. Shed during menstruation. Stratum basals. Replaces stratum functionalis each month. Myometrium. 3 layers of smooth muscle. Perimetrium. Visceral peritoneum. Blood supply to the uterus. Uterine arteries. Branches arcuate arteries and radial arteries that supply the myometrium. Straight and spiral branches penetrate to the endometrium. Spiral arteries supply the stratum functionalis. Their constriction due to hormonal changes starts menstrual cycle. Vulva, pudendum, mons pubis, fatty pad over the pubic symphysis. Labia majora and minora, folds of skin encircling vestibule where fine urethral and vaginal openings. Clitoris, small mass of erectile tissue. Vulva vestibule, masses of erectile tissue just deep to the labia on either side of the vaginal orifice. Female reproductive cycle. Controlled by monthly hormone cycle of anterior pituitary, hypothalamus and ovary. Monthly cycle of changes in ovary and uterus. Ovarian cycle. Changes in ovary during and after maturation of oocyte. Uterine cycle. Preparation of uterus to receive fertilized ovum. If implantation does not occur, the stratum functionalis is shed during menstruation. Hormonal regulation of reproductive cycle. GnRH secreted by the hypothalamus controls the female reproductive cycle. Stimulates anterior pituitary to secrete FSH and LH. FSH initiates growth of follicles that secrete estrogen. Estrogen maintains reproductive organs. LH stimulates ovulation and promotes formation of the corpus luteum, which secretes estrogens, progesterone, relaxin and inhibin. Progesterone prepares uterus for implantation and the mammary glands for milk secretion. Relaxin facilitates implantation in the relaxed uterus. Inhibin inhibits the secretion of FSH. Overview of hormonal regulation. Phases of female reproductive cycle. Hormonal changes. Menstrual phase. Menstruation lasts for 5 days. First day is considered beginning of 28-day cycle. In ovary. 20 follicles that began to develop 6 days before are now beginning to secrete estrogen. Fluid is filling the antrum from granulosa cells. In uterus, declining levels of progesterone cause spiral arteries to constrict, glandular tissue dies. Stratum functionalis layer is sloughed off along with 50 to 150 milliliters of blood. Preovulatory phase lasts from day 6 to 13, most variable timeline. In the ovary, follicular phase. Follicular secretion of estrogen and inhibin has slowed the secretion of FSH. Dominant follicles survives to day 6. By day 14, Graafian follicle has enlarged and bulges at surface. Increasing estrogen levels trigger the secretion of LH. In the uterus, proliferative phase. Increasing estrogen levels have repaired and thickened the stratum functionalis to 4 to 10 mm in thickness. Ovulation, rupture of follicle and release of second oocyte on day 14 cause. Increasing levels of estrogen stimulate release of GnRH, which stimulates anterior pituitary to release more LH. Corpus hemorrhagicum results. Signs of ovulation: increase in basal body temperature. Changes in cervical mucus. Cervix softens. Middelstimers, pain. Post-ovulatory phase, most constant timeline equals lasts 14 days. In the ovary, luteal phase. If fertilization did not occur, corpus albicans is formed. As hormone levels drop, secretion of GnRH, FSH and LH rise. If fertilization did occur, developing embryo secretes human chorionic gonadotropin, HCG, which maintains health of corpus luteum and its hormone secretions. In the uterus, secretory phase. Hormones from corpus luteum promote thickening of endometrium to 12 to 18 mm. Formation of more endometrial glands and vascularization. If no fertilization occurs, menstrual phase will begin.